We are live on a YouTube streaming video for the Auburn Medical Group with Dr. Mark Vaughan in the kitchen, talking about issues that are related to a medical practice and independent medical practice today. Well, I guess it could apply to some of the larger medical practices too. We'll see what you think. So once we get going, which will be about 2 minutes in, we'll start having a lot of communication with people who are watching and chatting in and doing super chat. Right now, though, I'm letting you know if you're watching this after it's been put up and it's not live anymore, to get notifications for things like this, you need to subscribe to the channel, and then you need to hit the little bell icon near the channel name on YouTube to set up your notifications so that you'll know when we're live with programming like this. So today we'll be addressing a very specific question: when or if it is ever appropriate for a doctor or medical practice to dismiss a patient from the practice. So I'd like to get your feedback on that and open up a discussion here so we can talk about some of the ways that this question might be looked at. We're about a minute in and kind of wondering why we don't have that many parties. Usually we have a number of people by this point. So they'll start coming in here pretty soon, because what happens is I put out a notification, or YouTube puts out a notification, and I also put one out on Twitter right when it starts. We didn't pre-announce this one at all. So it takes a little bit of time for it to circulate and for people to see it and then to click on it and find it. And people's notifications may come while they're in the middle of something else, and they'll come around later. People may actually get on Twitter or get on their mobile device, 10 minutes from now, and if we're still going, they'll jump in at that point because they want to see what the discussion is about. I'm wondering how much of the notification actually went out. Let's make sure that we are public so that people can find us. It must be, because there's 3 people here. And of course, the people who are here, go ahead and write in or type in messages letting us know your name, where you're from. And let me make sure the chat is on. Okay, so all chats will come through, not just super chat, but every kind of chat will come through. If you guys go ahead and write a little message there. Oh, here's the place where you adjust the settings. And it also might be that the microphone is not working. So if you're watching, go ahead and let me know that you can hear me on the microphone. I'm looking for some of your questions and comments about that issue of the question of patient dismissal. I guess I should define it. Patient dismissal is when a doctor or a medical practice dismisses a patient, meaning they tell them they're no longer welcome to come to get their health care there. The doctor is saying, I'm no longer responsible as the physician supervising your care. You need to find another doctor. Usually when it's done, they'll include some kind of a time during which, a duration during which they'll continue to fill prescriptions and take care of stuff that comes up to give the patient time to get reestablished with another doctor. Around here, it's kind of customary for that to be like 30 days. But my understanding is that there's no laws requiring any period of time at all, that there is that freedom to end your side of the relationship. Of course, it's considered patient abandonment if something is actively needing to be treated at the moment and is not at a place where it's stable. We do have a message here from Shady Maru. Hi, from Georgia. I can hear you. Okay, thanks. Thanks for letting us know, Shady Maru. I had a little bit of a question about whether the audio was working, because I had something to do with the way I was plugging the microphone in. So thank you for letting me know that. And we also have some other viewers. So go ahead and ask any questions that you have. I'll just talk a little bit more about some of the things that go into this. Oh, yes, thank you, Shady Maru. Some of the other things that would go into it would be if a patient was abusive to staff at the doctor's office, that'd be something that would be considered. Some offices will actually have guidelines that'll say, if this line is crossed, you're out of here. Or even missing appointments or showing up late, if that's done a certain number of times or in a certain way. Some people have rules about that. Sometimes just different rules are set up. And you'll find this in other businesses also, not just a medical doctor's office, where and I'd be really curious to know if there's other people out there who work in other businesses, other lines of work apart from medicine, that have some kind of criteria where you say, if we have a customer or a client or a partner that crosses such and such line, we actually have a policy for having them not be a part of our business anymore. The relationship is broken. I'd love to hear that. Okay, now where everybody's here, boy, just instantly, all of a sudden we got 30 people. Okay, that's great. We're just starting the discussion, so you guys are just in time. I think it's because of the notification getting out through YouTube for a while. Faith O says hi, and Team Epiphany Alex says hey. Miriam Ahmad says hey, Doc, and Victoria Watkins says hey. Hey to all of you. You guys are all saying hey today, so we'll do that. Hey, y'all. Okay, that didn't sound right coming from me. Some people sound like that. Faith is, yeah, thanking me. Oh, Audrey. Yes, Audrey, we're glad to have you here too. So we were discussing, yes, hello, Miranda. Glad to have you here. And Michelle Boland, howdy from Maine. That's pretty cool. Those who are watching this after it's live, I'm greeting the people as they come in. Of course, letting everybody know you're welcome to use Super Chat if you need to get through, because sometimes you have to. People with iOS do not have that option yet, but people on computers and Android devices do. They can hit that little $sign to get through the noise. Hello from North Dakota, from Kelly Robertsdahl, excuse me. And Owen Johnson, heyo, and Team Epiphany Alex has moved to Canada. But you can still get us in Canada. In fact, people all over the world can get this right now if they're awake. Patty Cox from Florida and Robin Morris from Phoenix, Arizona. So people from all over the place joining us for this discussion about the question of a doctor's office dismissing a patient from the practice, or saying, we are no longer maintaining the doctor-patient relation with you. You need to, within a certain amount of time, find a different doctor. Melissa Yowitz says, hey, excuse me. And Shannon Marks, hello from Pennsylvania. Tom Lehrer, we had a patient call our service and threaten physical harm to the office staff over pain meds. They quickly dismissed them. Yeah, threatening physical harm to a member of the staff, I think that would be grounds for a disruption of the doctor-patient relationship. That's not the kind of environment where you're going to have two-way trust and a good relationship at all. Audrey chimes in. Why would you dismiss a patient? Well, it sounds like some people will use the criteria of a threat of physical harm. I'm sure if actual physical harm occurred, that would probably be a criteria there too. And I believe it's because of things like that there is not any kind of, at least in the state of California, not any kind of minimum amount of time you have to allow the patient to still be your patient because of situations like that. No, if somebody's hitting, biting, scratching, you would not necessarily say that you have to maintain coverage of whatever they need for the next 30 days, especially if they choose to want to really be bad to you. Okay, so we have Karen LeBlanc from Nova Scotia, hello, and Rena. Hi, Rena. Rena has a special day coming up in, is it 2 weeks? No, not what?
4 weeks.
I'm sorry, 4 weeks. 4 weeks, Rena, 4 weeks. And by the way, it costs a lot of money to fly to Houston. But that's okay. Sandy Piswentz, hello from Wisconsin. Shannon Marks, sounds like drug-seeking behavior. Yeah. Omar B. Hey, Omar. Good to hear from you. And thank you again, Omar, for the time that you did spend on the Auburn Medical Group fan page, Instagram, and all that time you put into doing the captions for us on YouTube. Anybody else who's interested in participating in that, I think it's in the description of almost every video. Down in the description, it has a link that you can go to help out with our captions to help make them correct. And which is actually really helpful because as we start to put up some of the videos on Amazon so people can see them there, and so we can finally get to a place where they're free to watch, at least for Prime users, at least in the US. Now, there's a lot of conditions on that. We need those accurate captions, so that helps out. Thank you. And Anxiety 101, I think it depends on the reason why. For the best care, obviously you want to have a great working relationship between the doc and the patient. I agree, Anxiety 101. And, oh, Petra's here. Hey, Petra. Thanks for joining us. Team Epiphany, Michelle Boland. I was dismissed by a doctor office because they could literally not figure out what I had wrong with me. Told me, don't call us again. Is that even something you have heard? I'll go ahead and talk about that with my own experience from the doctor side of a patient that does have something going on, and you've gone through everything you know, and then you maybe even referred them to specialists, and aren't getting them where they and you also want them to be in a place where there's satisfaction that the symptoms that they're experiencing have, if it's symptoms that can't be lived with and aren't minor, that, if they can't live with them and you're not able to get them to a place where they're not having those symptoms, kind of used up all the people you'd refer to, all the specialists you'd refer to, and all the tests that would be appropriate for what you're doing, and then probably even some more. Yeah, I've had that conversation with patients where I've gone, this one doctor, even this one group of doctors has gone all we know to do. Maybe it'd be appropriate to see if somebody else can come at it with fresh eyes, especially with all the tests that have already been done. Sometimes, for whatever reason, one group is just not seeing it and somebody else will, just because of perspective. Not being the one who ordered it, but looking at it after the fact, different familiarity with different clinical syndromes, just from experience in medicine. You might get a different response with another physician. So that's where you actually use the term second opinion in the setting of primary care. And so in that situation, and I have had it happen rarely, and sometimes it's the patient's idea, sometimes it's my idea, where we go, you know what? We're not getting what we want here. We're not getting answers, and let's see if we can find that with the help of another primary care physician. It's not that we don't like the patient. It's not that the patient necessarily doesn't like us. It's just the wanted result is not occurring. And you kind of reach the end of everything that's available in that particular office. So that's a similar experience that we've had, but that wasn't a dismissal at all. It sounds like yours was, and I'm sorry for that. Ours it's totally just giving the patient this option, and sometimes they take it, and I'm okay with that if we're not getting to the answer, and I'll be have enough humility to say sometimes that has been the case. We don't know everything about the human body. Oh, we've got a question from Audrey. What exactly is a pain clinic, and what do they do for people? Hopefully they don't dismiss them, although they probably have rules about it too. I'd also really like to hear from somebody outside of the field of medicine that talks about what in their line of work a dismissal of a client or a partner or a customer would be, and rules that you may have had. Okay, we've got Miriam Ahmad. This might be another off topic. Someone unsubscribed. Yes, that happens all the time, Team Epiphany Alex. Rose Dawson, when you have 100,000 subscribers, yeah, the numbers go up and down. So there is some down. And yeah, Rose notes that sometimes it might not be a good fit. Elizabeth, when you refer a patient to a specialist, are you discharging the patient? No, not at all. No. In primary care, we are still connected with the care that the patient receives. And we're getting the notes back from the specialist we refer to. This is the way it's supposed to happen. Doesn't always happen this way. It's supposed to happen that when we refer to the patient to a specialist, the specialist sends back a note in a timely manner, like preferably that day or barely after, so that we can read what went on, what their thoughts are, what they're doing with the patient, if they're continuing to care for the patient in that specialty. And if we need to do something, like a lot of times a specialist will order imaging, for example, of a part of the body, and it'll include organs that don't really fall under their specialty, so they kick it back to us. And that's appropriate, because we're the primary care doctor. We should take care of whatever it is that's not under their specialty. Yeah, I'm glad to explain that for you, Michelle. That was good. Anxiety 101, obviously there are ethics involved in why you dismiss someone in most professions. Like if you just generally think the person stinks, not okay, lol. I don't believe we're required to have a reason under law, and you're right, ethics come in here. There's always going to be a reason, and so that's why I'm asking you guys, what do you think is an appropriate reason versus what's not? And you think just for any old reason, just don't like the patient, is not an appropriate reason. Okay. And we thought that having violence in the office was an appropriate reason. Miranda says, my daughter's doctor left his clinic, gave up no notice to move out. The staff and his patients were very upset. That's a way of dismissing patients, isn't it? Just leaving town. You're welcome, Marion. Thanks for asking. And let's see here. There we go. Okay, so we still haven't seen what I'm really hoping to get here, and that is somebody from outside of the field of medicine that has something similar. Okay, violence, not following advice repeatedly. Oh, here we go. Not following advice repeatedly. Okay, so it could be the doctor's giving advice that a patient just doesn't like or isn't consistent with their values for health care. And that's not necessarily a reason to dismiss a patient. We want to work with the patients and with their values for what is priority to them. I know that we have heard of doctors dismissing people. For example, the vaccine issue. Family doesn't get their children vaccinated, and so the doctor dismisses them from the practice, or somebody's not getting their mammograms or the colonoscopy, the doctor dismisses them. That, of course, they have the right to do that, but many of us in medicine don't think that that's really working together with the patient. But you said repeatedly. If a patient just, is on the internet or listening to their in-laws or cousin or neighbor across the street and getting all this advice counter to a medical professional, and they keep going with that instead of advice from the medical professional, yeah, it gets frustrating. It does reach a point where you go, you know what? We really have different values when it comes to the provision of health care. Let's part ways. And I have felt that way, and I have tried my best to, as eloquently as possible and as nicely as possible, express that to a patient before, where, we see it differently. Our values are different. We have completely different healthcare models of how the body works and what's good and what's bad, and it's not working for us to be together. And it wasn't one of those things where we send a letter and say, you're out in 30 days. It's more of a suggestion, and that has happened. Okay, sorry, I lost track of it. Oh, again, if you want to get through on the comments, just do the super chat. Or if you just want to do super chat, go ahead. Omar, what would you say the most popular issue or condition that brings patient? No, we're not talking about that today. BooBoo, I'm shocked that I've never been dismissed by a doctor. You're shocked. You're making me wonder now, BooBoo. I always try to bring a sense of humor with me to the visits. Maybe that's why they keep you around. You're funny. It makes bad news easier to take, at least for me. And yeah, Diesel Darlin agrees. Audrey, I dismissed a child once while I ran a daycare. Oh, Audrey, good. Another field other than medicine, so we can get an example. Could you tell us more about what you thought was an appropriate reason to dismiss the child from the daycare? I'd be very curious to know what that criteria was. What was the line that was crossed? Rose says, keep in mind, docs are human. Oh, thank you, Rose. I like to think so. Shady Maru, right, Rose. Petra, I've been working as a nurse before I got sick for years, and now the patient, so I have to see it. Yeah, that's right. That is a hard thing to go through, Petra, to see it from the other side. And I know very little about that, about seeing it from the patient side, but the little I know makes a huge impact on next time I see a patient with something similar. Diesel Darling, got prescribed nose spray one time, told doctor that nothing went up my nose but my finger, and I'm just going to die laughing. Anxiety 101, lack of payment could cause. I think that's an appropriate thing. Yeah. I don't believe we necessarily have an obligation, because the patient decides so, to provide free services. Nobody else does that on our end. Our utility company doesn't continue to give us electricity if we don't pay, but yet we have the lights on for providing health care. So I think that's a legitimate thing that you would expect effort to be made to make payment. At the same time, we in our office do not kick people out because of non-payment. Now, if it's repeated, then thankfully it's never been. So I don't know. We'd have to cross that bridge when we come to it. As it's been, when people have had difficult times, we say, hey, we recognize you have difficult times. That visit that you weren't able to pay for, it's forgiven. We'll start over. And hopefully when you are able to pay or get insurance, we'll be able to just, continue on. We have had times when people weren't able to pay for a period of time. And as long as we have a conversation about it and we know that's what's going on, hey, I'm good with it. We're able to provide the care and they need it. And if they were able to pay for it, they would. And then when they're able to, they do. I will say I don't like it when we do that for somebody and then they get Kaiser. And so when they do get the insurance, they go somewhere else so that some other doctor can get paid after we've been taking care of them. I don't like that. I don't appreciate that, and I'll leave it at that. Or if they were to go to a different doctor who wouldn't give them that consideration. Melissa Yertz had an experience of missed first appointment with the doctor. Wouldn't see me, likely saw and got the PCOS conformed to letting go people for caregivers. It's at it. I'm sorry, I didn't quite get that one. And okay, good night, Omar. Thanks for joining us. The cops helped dismiss him, but I changed the locks. Wow, BooBoo, you must have had quite a story there. Going back a little bit, see what it was that BooBoo was writing. I dismissed my husband from my home. Does that? That's not your current husband, I take it. Or if it is, we got some catching up to. Oh, BooBoo, we got to get together this week. I am sorry. It's so far into October, we haven't had our Google Hangout for patrons that we have every month, but we're going to. And we do have it every month, and BooBoo will also confirm that, yes, we do have our Google Hangout every month. Anxiety 101 notes that some professions let go of clients when they haven't seen them for a while to make room for new clients. That makes sense. That totally makes sense. If somebody's not participating and they're not, they're just kind of burning space over there that costs you a little bit. Now, in our case, I don't know if we'd necessarily have that same situation where it costs us money to keep somebody on the roll. So I don't know if that really applies to us. What night's good for me? Do we have anything going on tomorrow?
No.
BooBoo, are you up for, say...
What's the one to watch?
Oh, I'm sorry. Tomorrow's discount night at the movie theater. Wednesday night. Wednesday night? No, I've got a SIP meeting Wednesday night. Thursday night. BooBoo, Thursday, 8 o'clock. Thursday, 8 o'clock. Okay. If you can, let me know. Victoria Watkins. Missed an appointment, received a letter saying if I did it again would be... We actually send out those letters. No, if somebody misses the very first appointment, because our new patient appointments are long because you have to get the entire health history of this patient into the record system. So and plus, oftentimes they really want to get something addressed too. That's why they're getting a doctor at that time. So you can imagine that this is not just a regular checkup appointment, the very first appointment. There's a lot going on there. And we do ask people, we do tell people we're not going to schedule you for a first appointment if you miss the first one, because it burned a lot of time that we could have had patients being seen, not just a single patient. Because it's a new patient appointment, it would have been a couple of patients that we could have seen with that time, and we were just sitting there twiddling our thumbs. Hopefully we got, like a same day in to help make it a little less damaging. But yeah, if you miss the first appointment, sorry, that's just one appointment you don't miss. That's it's a bit harsh, but it shows a certain level of somebody not being real responsible with appointments to me. Oh, we got a message here from a LeeAnn Vaughan. I checked on the medical malpractice website. They say appropriate reasons are non-compliance to office policy, which we can make up whatever policies we want, treatment or follow-up, verbal abuse, and non-payment. Okay, well, certainly I don't think I've ever violated any of those. And okay, let's look at that again. Non-compliance to office policy, which that gives an awful lot of leeway there, because you can make any policy you want and call it your office policy. Non-compliance with treatment or follow-up. We talked about that before, where we make recommendations, and if repeatedly they're just totally going their own way, they got their own idea what healthcare is, they're going to their naturopath and their chiropractor and getting all sorts of stuff that's just contrary to what you're doing. They might as well just stick with whoever it is they actually trust in that circumstance. LeeAnn also writes, thank you, LeeAnn. The California Medical Board says you have to give at least 15 days. Oh, there is a minimum. Okay, so we're certainly well within that with or outside of that, with our 30 days, so we're good on that. Petra notes that she had a psychiatrist couple, a couple years ago, not a psychiatrist couple, had a psychiatrist couple years ago, you dismissed the psychiatrist. He wasn't appropriate at all. Oh, yeah, it can go both ways, can't it? Yeah. Julia, an undiagnosed toxic thyroid. I was rude to receptionist, asked to find new doctor. New doctor was shocked as recurrence of my Graves' disease should have been obvious. I'm sorry, who's doing the dismissal there? Oh, his siblings here. BooBoo. I always say that my ex had a terrible inferiority complex, and that was very fitting as he was very inferior. Okay. Oh my goodness. Did you know that you guys live right across the border from each other? You probably knew that. Backing up a little bit because I think I'm caught up with your comments there. So, let's see. Boo-boo, I didn't follow directions, but I'm honest with my doctor and he's tolerant of me. And Julia got dismissed. The receptionist. I was rude to the Oh, yeah, see. You know, being rude, generally what we'll do is whoever the patient was rude with, we have them apologize to that staff member, which I think is appropriate because we are not desperate for new patients. And there's a lot of really pleasant people out there who would like to be in our practice and are waiting to get their new patient appointments because we're seeing existing patients. So if somebody's rude, I really feel like it's okay to say, you know what, you'd probably rather work with someone else if you're rude to us, and there's people who would like to be in this practice to take your spot. Catherine Smith, I was received a certified letter from my primary care firing me as a patient. I did not make a specialist appointment quick enough for him. Oh yes, interesting. You talk about going to the specialist. We've certainly never discharged somebody or dismissed somebody because of non-compliance with a specialist or with the appointment to the specialist. But I'll tell you the story. I have a patient, actually patient couple, and they both have, they're getting older and some memory difficulty, and they missed one too many appointments with one of the specialists, very important specialist. And the specialist wrote in the medical record why he was dismissing him. I wrote right back in the record a message to the specialist, explained there's a memory issue here. We're trying to get them into the neurologist, but part of the memory issue is getting into the neurologist, and there's not a lot of family support. Please reconsider. And so he actually did keep the patient in his practice. I was very pleased with that. That he saw, and I think because it came from me, that it meant a lot to him, and so that he did. I don't know if it came from another doctor, if necessarily he would have taken them in like he did. Anxiety 1-1. To be fair, the receptionists take a lot of flack. Yeah, they're right there answering the phone and seeing people as they come in the door. So they are like body shields, like meat shields on my behalf, and I can't thank them enough for what they get up there at the front. And I know because of the days when I was in the front taking it all as a medical student and as a resident, and when I worked in an insurance office answering the phone and at the front desk, I know what it's like to be in the front. Sandy, what do you do when you try everything the doctor told me to do and I'm not seeing a different? What would you do? It's appropriate to have a conversation with the doctor saying exactly this. And if they have nothing else there that sounds like a reasonable option to pursue, bringing up, hey, maybe at this point it would be appropriate for trying a different primary care. Urologist in one of your videos, Dr. I did write a comment about a urologist one. I don't remember that one. Julie apologized. That's another thing. Yeah, Julie, you make a very good point. I was talking about the patient where it was the memory problems that made them non-compliant. And so if the person's got a toxic thyroid and that's why they're behaving the way they are, it's the medical problem causing the behavior. We are responsible for helping with the medical problem. Although that can be taken too far, for example, with patients who are non-compliant and, we can't be responsible for their non-compliance. So there's some gray area there. It depends on the issue. Everyone should work retail customer service at least once. It gives you a different perspective on the world. Unfortunately, not a nice one. And Boo Boo's writing back. dismissed as a patient from my psychiatrist because I left the hospital AMA. That is a criteria that some people will use. And going back to what I was talking about earlier, those of you that heard it, I talked about how just because you have a difference of opinion and the patient's not compliant with one particular recommendation, that's not necessarily, for me, grounds for dismissal. Maybe for raising the question and talking about it, but a lot of times it's just a matter of having different values and working through that together. It can reach a point where your different values are to the point that your entire philosophy of medical care is on a whole different sphere. So there's this whole range there of, what do we disagree about? What can we work together on? Okay, moving back. Oh, Petra got some good news. Good, Petra. Julia, Anxiety 101 is talking back to Julia. And we also have Janine Jones. Was referred to a roomie or a rheumatologist years ago who said, it's all in your head. Go home, take a pill. On the plus side, I found my current rheumatologist, who's also my PCP. Oh, okay. She found that I had scleroderma. Yeah, it's actually in the rheumatologic disorders you see the most of this sort of thing going on. So it's kind of disturbing that a rheumatologist is the one that was the bad guy or bad person in this story. Victoria, wondering if my son's dentist will dismiss our family. I left a comment in the comment box stating that he's great with children and does great work, but really irritates me in the process. Hopefully not. Hopefully they have the box just for the purpose of getting that feedback so that they can learn and hopefully not be that way. Okay, so thank you guys for a great live YouTube here. I really enjoyed it. I enjoyed your feedback. I'm going to take this with me as I consider these different perspectives on policy, and we'll just here take a quick little moment to read Petra's note. Full body scan last week. My tumor has decreased with 1.4 centimeters, so total 1.6. Good, Petra. We are all glad to hear that you're getting better and that your tumor is getting smaller. Raul tells us you really enjoy the videos. Thank you, Raul. And first time but not last, thank you, Janine. Make sure you have notifications turned on, the little bell. Back to Petra, it was 10.4 centimeters from, good. Rawls in McAllen, Texas. And, okay, thank you all. We do have a video coming out tomorrow. It's not actually a procedure. It's just Lisa being silly about flu shots, a little promotion for people getting their flu shots. And then we do not yet have a video for Friday. I was thinking about making the one we did live today with the eye, with the sty and the chalazion. And I'm not so sure I said chalazion in the video, but that's the name for the thing on the lower eyelid on the lady that we saw today. Oh, Dr. Gwen got a flu shot today. Didn't let us get video of it, though. Dr. Eye Candy. Yes, BooBoo, that's Dr. Gwen. And so anybody who doesn't know, BooBoo thinks that Dr. Gwen is Dr. Eye Candy. And I should tell them what they called you in your residency. Because of what one parent of a pediatric patient called him, he got the name Dr. Delicious, and they actually called him that in his residency. That's how they knew him. Oh, and Petra's going to go get chemo. And Dr. Gwen had his whole family get flu shot together. Yes. Okay, so until next time, Dr. Gwen, Dr. Mark telling all of you to stay in good health and don't get dismissed.